A chorus of over 1,000 current and ex-staffers from the US Department of Health and Human Services, HHS, have penned an impassioned letter to Secretary Robert F. Kennedy Jr., urging him to step down from his position. They argue that his tenure has jeopardized the nation's health, a sentiment that's reached a boiling point following the controversial dismissal of Dr. Susan Monarez, the recently appointed director of the Centers for Disease Control and Prevention, CDC, by the Trump administration. This move triggered a cascade of resignations among high-ranking officials within the CDC, amplifying concerns over the direction of public health policy in the country. The letter, also directed at Congress, cites several contentious actions taken under Kennedy's leadership, including the orchestration of Monarez's termination, the departure of seasoned CDC executives, the appointment of political zealots to key vaccine policy positions, and the abrupt revocation of emergency use authorizations for COVID-19 vaccines. The employees assert that these decisions were made without adequate transparency or scientific justification, casting a shadow of doubt over the administration's commitment to public health. In defense, HHS Communications Director Andrew Nixon stated that Kennedy views the CDC as needing profound reform to restore its global reputation as a bastion of public health. He highlighted Kennedy's pledge to base decisions on evidence-driven science, a principle that has guided his efforts to combat the chronic disease epidemic since taking office. Nixon also addressed the August 8 shooting incident at the CDC headquarters, which left a police officer deceased, asserting that any attempt to link necessary public health reforms with the tragic act of a disturbed individual is politically motivated. Previously, hundreds of HHS staff had expressed their concerns to Kennedy regarding the spread of misleading health information and the safety of the workforce. Despite their request for a response by September 2nd, Kennedy has not personally addressed their grievances. The employees, many of whom chose anonymity fearing retribution, emphasized that their signatures reflect their personal convictions. They now implore the President and Congress to appoint a new HHS secretary whose credentials and background are rooted in independent, peer-reviewed science. The call for Kennedy's resignation has gained traction among certain congressional members and public health advocates. Senator Patty Murray, a Democrat from Washington and a prominent figure on the Senate Health, Education, Labor and Pensions Committee, has joined the chorus, urging the White House to dismiss Kennedy following Monarez's removal. Similarly, Senator Bernie Sanders, an independent from Vermont, and Representative Rosa DeLauro, a Democrat from Connecticut, have echoed the demand for Kennedy's resignation or removal, citing his controversial stance on vaccines and conspiracy theories. Senator Bill Cassidy, a Republican physician from Louisiana and chair of the HELP Committee, has called for increased oversight in light of the recent high-profile exits from the CDC. He has advocated for postponing the upcoming meeting of the CDC's Advisory Committee on Immunization Practices, scheduled to September 18th, due to allegations surrounding the meeting's agenda, membership, and adherence to scientific procedures. Cassidy stressed that any recommendations emerging from the meeting would lack credibility without thorough scrutiny and stability in CDC leadership. Kennedy is slated to appear before the Senate Committee on Finance on Thursday for a hearing titled The President's 2026 Healthcare Agenda. The unfolding events underscore the growing unrest within the health sector and the political arena, signaling a pivotal moment for the future of public health policy in the United States.